Hello, everyone. This is Cindy Rubin. I am a general pediatrician and breastfeeding medicine doc in the Chicagoland area, and you are watching Keeping in Touch, which is a weekly series. Today is our first day that we are going live at 9 a.m. Central Time, and this is where we're going to be from now on. So you can find us live. If you do have questions or comments, we can see those. So I'll be watching for those. So if you have questions that come up, just throw them into the chat, and we will check the chat later. So if you have questions that come up later that we don't get to during this chat, just go ahead and throw them in later. So my guest today, oh boy, I just lost my little thing. My guest today is Dr. Mariel, now tell me if I say this wrong, Paralitici-Morales.
Close,
Okay.
close. You did very well. You got an A.
Okay, you say it.
Mariel Paralitici-Morales.
Okay.
Dr. P. That's why
Dr. P, that's what I'm going to say.
I've been Dr. P since 2010, actually.
Okay,
I really like it. So
I like it, yes. Dr. P is from San Juan, Puerto Rico, and she is trained in New York City and is a child and adolescent and adult psychiatrist. And she treats a whole number of psychiatric illnesses in that whole huge range of ages that she has been trained in. And today we have her on our show to talk a little bit about postpartum depression and the effects that it can have on new moms and their relationships with their babies and breastfeeding and those sorts of things. So welcome, Dr. P.
Thank you, Dr. Rubin, for inviting me and for having me as a guest today. It's really a pleasure to be here. As a side note, this is my first Facebook, YouTube live that I do. So, I mean, not live that I do, that I am a guest. I do my own lives, and I hope I host my own show. Conversations with Dr. P on Fridays. So it's just a new thing this year that I said, let me see if I can just do more guesting appearances to, do more teaching and things that I love to do. Well, so thank you.
I think you are already rocking it. So
thank you.
We are honored to be your first. So tell me a little bit about just how you ended up where you are now and what you are doing, because you kind of moved from one area of a career to another over the last year.
So it's kind of a long story, which I'm going to do very short, but basically, since I graduated from New York. I did both adult and child psychiatry programs. And since I graduated, I have been totally connected to corporate medicine, different settings, hospital-based, inpatient units, big groups, physicians, specialty groups, private practice. You name it, PhD programs, IOP programs. I've done basically a little bit of everything. And over the years, changing and just tasting the waters in different scenarios. I noticed that my average stay on this type of job varies from 2 to 5, 6 years. And I was noticing it always starts pretty good. I mean, normal, what you really are trained for, having time, having, your quality spending thing with your patient. But over time, when the caseload starts to increase, because now you're credentialed with all the panels, now you're taking everybody, now your schedule it's really there and you start having the push from higher levels. It's the system. It's not an individual problem. It's a system problem.
Right.
That after a couple of years of doing the job that you really signed for, after a couple of years, things starts to just not work the way they used to work. Scheduling becomes an issue, overbooking, or I don't know, too many things that happen in corporate medicine due to the limitations that we have
Right.
from many areas, including insurance companies, policies, procedures, regulation, all those things that are happening now, and becoming even more difficult for us to really do our job of doctor.
Yes.
Now it's
Yes.
so many other jobs. So over the years, I just kept stretching my batteries, my energy,
Yeah.
my everything. I love what I do. I've done it for many years. But when you get to the point of being on an 8 to 5 schedule of 26 patients, or everyone 10 to 15 minutes, but really the expectation it's less because you have to do documentation, you have to do other things, it becomes, it's unrealistic.
Yes.
We stop taking care of ourselves because we have to do our job. So
Right.
over the years, I started to decreasing time, to decreasing hours, from 30 hours to 24 hours until I finished on 13 hours per week.
Wow. Okay.
And I stayed around 5 years and a half in this last job, which I really loved and enjoyed. But again, the system, it was making it so difficult for me that at some point I decided to, you know what, I'm done. And I told my husband, I really don't want to do this anymore. And at the time, he needed me to help him in his project of our company, AMP Psychiatric Services, where we provide different levels of care in mental health in different settings and companies, agencies. And I just decided to go into that route and say, you know what? It's our business. It's going to be a different kind of motivation, and still do
Yep.
what I love to do. Anyways, now it's a year and a half later. Well, it's longer, the company, but when I fully moved to our company, and I still do things that is not what I like to do.
Yeah.
Know if it's because I still connected to the insurance companies and to the bureaucracy of paperwork and timing and meeting expectations for others or for systems that I told my husband one day, you know what, I think I'm going to do this solo. What do you think? So it started from there, from an idea,
Yeah.
and Psychiatry Boutique came up from actually both together, us brainstorming about what we want to see ourselves doing in the future. And so started a big general picture, but I said, hey, I'm going to start it. I'm going to do it. And I want to master what I know what to
Yeah.
do,
Yeah.
which is mental health. And I want to be the doctor, and I want to be my boss, and I want to have my own business, and I want to do it the way I can do it and be doing something for myself and for
Yeah.
my mental health. Because
Yes.
I was not really doing well at the end. I was like always rushing, documenting very fast. Patients, I never had issues with my patients. My visits were always great. My patients always had great things to say about me. But inside me, I was broken.
Yeah.
And this is my journey. I opened my practice in September 29th, officially October. And since I just feel happy because I'm not rushing, because I'm providing the care that I think it's the best.
Yes.
I
Yes.
do feel I am a great doctor, and that I provide the care that, each one individually needs, because
Yeah.
everyone is different. So I take a different approach with everyone. And
That's
yeah,
fantastic. Well,
that's me.
I'm so glad that
It's not
you
easy, not
yeah.
easy. But when the hard
No.
work comes from you and you do all these things and you learn all these new skills and being in this new world of being your boss or you being the administrator of everything,
Yep,
it makes you be another person. You become
absolutely.
a totally different person and a good person, because I do enjoy the person I feel I'm becoming, right?
Yeah,
I'm so
yeah.
different. And so that's me. And I am a mom of
Yay.
two teens, 13 and 15-year olds, both
Okay.
soccer players that are busy every day of the week and maintain me very busy after work hours, and a wife. And, it's a busy life,
Yes.
but
Yes.
so far enjoying the ride, and I am happy. I am
That's
happy of doing what
awesome.
I'm doing.
I'm so glad you figured out what feels right to you, because I think that that is just so important. And unfortunately, it's what so many of us lose in medicine these days, because we think that we have to do things a certain way and we
Yeah.
don't. So,
And
yeah,
definitely we don't.
yeah, yeah.
It's not the perfect way, or it's not, it's the way you can do it.
Right,
Because if we were not well with ourselves, how we're going to provide the service
right,
that our patients needs,
right.
So,
Which is
yep,
actually a very good
yeah,
segue into our topic today, because postpartum depression is something that affects a mother, but it also affects all the people around the mother. And I think that sometimes, we as women feel that we are kind of martyrs and we need to put up with things in order to take care of our other people. And
definitely.
we forget to take care of ourselves. And when we don't take care of ourselves, we cannot take good care of other people when we lose ourselves. So, let's talk a little bit about postpartum depression. And I just want to start by saying that, recently we've started to refer to postpartum depression. So we've broadened this, our thinking about the mood problems that happen after having a baby, to include anxiety, which I think is also incredibly common. And often people can have both anxiety and depression, and sometimes just one or the other. And we
Definitely.
call it now perinatal mood and anxiety disorders. So
Mm-hmm.
postpartum depression kind of falls within that group. Doesn't really change how we treat it or address it, but I just wanted to kind of bring that up, that you may have heard people, our viewers may have heard perinatal mood and anxiety disorders and wondered what that was and if it was the same thing as postpartum depression,
Correct.
and they are connected. And PMADS is what it is for
Mm-hmm.
short. So you may hear that. So this is incredibly common. So 1 out of 7 women will experience some sort of perinatal mood and anxiety disorder, which is
Correct.
huge. So, and a half of those women, it will be their first time having any sort of mental health problem. So it can really
Mm-hmm.
come out of left field. So tell us a little bit more about what this is and what it looks like, and what we should be kind of watching for when it happens.
So, very good question. Um, Postpartum depression, as you said, in the definitions and what it is, it keeps changing over time, as you said. And now it not only covers the time after the mother had the baby, but also they includes the perinatal part of it, which is while you are pregnant, still having the baby inside you, but not yet fully mom. I mean,
Right.
fully delivered, right? And there's the period prior to getting pregnant, which is the preparation or the time just a couple of months before getting pregnant. So there are multiple risk factors that can make a mom going into more towards the route of having depression during pregnancy. And many of those factors can be related to maybe their own past history of depressive episodes. It could be a family history, mom, dad, siblings, of major mental health disorders, including mood disorders, their environmental factors, so socio-economic factors, their relationships, how strong or weak are the relationship with their significant others, education, resources or ability to get into care. All those factors contribute to if I'm going towards the route of possible depression versus not. So the more positive factors, the better the coping strategies and skills they have during this period. However, taking taking the risk factors in consideration when the moms are already pregnant, and there's a comparison between previous depressive episodes versus the episodes while pregnant and after pregnancy, and these episodes can be a little bit more harder. This episode of depression can be more significant for the mom, even knowing that she has history before. But this one is different because it's not only the factors or the stressors contributing to the episode, also your body is going through a lot of changes, hormonal changes, the growth, plus your mental, the mindsets, all the things that are happening psychologically during this physiological changes make us just the ball of emotions. Okay, we are just an explosion of different mood shift during our pregnancy.
Right.
So not understanding, not able to identify these are new things that I feel in my body because I'm pregnant, not because of other things, can make them feel more at risk of feeling worried, stressed out. I don't know what's going on. I feel off. I'm not really thinking clearly. I feel worried all the time. My breathing, it's always heavy. It's and those emotions really are at the same time moving towards the baby. It's like a filter through that connection that brings all that emotional and physiological, all the aspects of the development of the baby. So as you said, 1 in 7 of new moms can experience postpartum depression. However, I believe it's a 75 to 80% of women in general might report changes in their mood or mood dysregulation during the first 1 to 5 days after delivery. This is pretty common for new moms and also for no new moms. It's a mom, second mom, third time
Right.
mom, etc. But I lost the track of on the actual point. Oh my God.
Just what depression is and what it can look like.
So the postpartum blues. So this is the period where most of all will experience some sort of sadness, worries, anxiety, maybe a brief mild difficulty sleeping, some changes in appetite, a little bit of isolation, but still in functioning with the rest of. So those are blues. Usually these symptoms can last from 1 to 2 weeks after starting to have the symptoms, and the symptoms are milder. They will go away after some, few weeks. With the postpartum depression, all the symptoms are much more severe. And after a month of experiencing the symptoms, the patient can experience a significant decline in functioning in their areas of their daily living, in their functioning of work performance, in the ability of parenting other children around the house. So many areas starts to decline.
Yeah.
So it's very important, the support around these
Absolutely.
families, about these moms. And if you are a new mom, that support, that education about what's going on in your body, what can happen, what can change, what are the consequences if I don't do ABC. It's important for them to really have direction, understanding on the importance of following through different recommendations throughout pregnancy, taking good care of your nutrition because your baby is eating from you. So one consequences of postpartum depression is poor nutrition, and poor baby care or prenatal or pregnancy care. So moms doesn't know what's going on inside them, inside their baby's growth, if they're really growing the way they're supposed to.
Right.
And many times we can pick up cases that are too late now, and we couldn't do anything before of the delay in treatment. Um, so many things going on in the
Yeah.
topic, but as you said, it's very prevalent, and 50% of these moms that are actually having these symptoms are not really diagnosed. So
Yeah.
50% of these moms actually go through the whole pregnancy, and process without any type of help.
Yeah.
So
And I think
it's
that's, yeah, I was going to say that's a failure of the system, unfortunately. That,
once the system pick up, or the doctor can pick up this, it's very important, the role of the doctors, the pediatrician, the OBGYNs, the psychiatrist, if there's one already in the picture, because in all these visits we screen and we can identify these moms. Pediatrician is not only focus on the mom, on the baby, it's also focus is the baby receiving all the areas necessary for the proper growth,
right.
including the more emotional nurturing of the mom. So
Right.
in every pediatrician visit, I believe now there are guidelines for
Yeah.
all of
Mhm.
us to screen moms, because we can actually prevent future issues with a toddlerhood, or moms with new moms, or second, third moms with adolescent kids at home, that because of their depression, the bonding with the baby is getting impaired or affected, plus the interaction with the toddler or adolescent um, or other uh, kid in the household can get affected.
Right.
So important those visits, because all in each visit we can pick up someone. It's different levels of screening. So in the OBGYN, in our prenatal visits, we need to actually fill out those questionnaires, answer the question when the nurse asks you, "Mom, how are you doing? Are you dealing with this? Are you sleeping the hours that you should be sleeping? If not, please let us know." Anything that we can pick up early
Yeah.
will help for a better prognosis and earlier treatment.
Yeah.
There's a
I,
big gap also, sorry, and I'll give it,
no, that's okay. Go
there's
ahead.
also a big gap in the connection from once I identify the mom and now referring it to the
Yes.
to the doctor. That could be either a system problem, waiting for approvals, insurance companies, etc. So it's difficult, but increasing the frequent visits of the baby can help in monitoring the mom in the meantime that they get connected to the specialist.
Right. And I think that's important for moms to recognize that when they do go to their pediatrician appointments, that they can reach out to that pediatrician even when they are struggling. It's
Yes.
not just about the baby, like you said. And I think, I've had this happen just in terms of breastfeeding, that, I was seeing a baby for their pediatric appointment, and I asked a mother about the breastfeeding, and they bring up some sort of problem, and I started to try to address it. And later she said, I wasn't even going to say anything because I didn't think this was the right place for me to bring it up. I'm here for my baby's appointment. This isn't mine. And unfortunately, the way our system is set up, moms don't get very great follow-up care. It's not
Agree.
that the OBs or the doctors of the mothers don't care. It's just the way things are set up.
Yeah.
You often will see your pediatrician much more frequently than you're going to see your own doctor. And then after that 6-week visit postpartum, you may not go to the doctor again for a year or until you get pregnant again. And meanwhile, you could have so many things going on with you, but yet you're seeing your pediatrician very frequently, monthly, every other month for that first year. And we can help you. Even if we can't actually treat you, we can get you to the right places, and we want to be there for you. So never be afraid of asking. And also, I think what's interesting about what you said is that, I think a lot of people wonder, well, I don't know, is this still postpartum blues or is this really something now? And it doesn't matter. It's not, you don't have to worry about that. If you're feeling something and you're worried about it and you feel like you need support, just reach out. It doesn't have to be pathologic.
Agree.
Yeah.
Agree. I
Yeah.
think that the power of support, regardless of where it comes from, it could be friends, adults, teachers, mentors, doctors, therapists, anyone that you feel comfortable to opening and being a little bit more vulnerable to, will give you that first feeling sense of there's someone that listens to me. Let me just try and look for whatever I need to. It knowing that there are people out there, only that it's therapeutic for someone that it's just looking for possibilities. There's people who just get stuck and
Right.
I'm in this dark, place, but there's others that allow that end and brightness of I can reach that light, I can get there. That small motivation can open the door for so many great opportunities for you to grow and for you to say, hey, I am a mom now. I have new responsibilities. I'm going to do this. I know it's going to be hard, but I have my doctors here. I have my husband or significant other with me. And if not, let's work with that. And when we talk about treatment, it's very important to mention the family involvement, the significant other involvement,
Right.
and all those things. But it's a very difficult trajectory. It is postpartum depression can be very disabling, can be a very serious consequence, and can develop into either more complex scenario, to the point of mothers even manifesting psychosis, and psychosis to the point of having feelings to hurt the baby. Actually, I believe the stats are 30% of postpartum moms, depressed moms, are having increased suicidal thoughts of hurting themselves. 41 reports thoughts about harming the baby, not actual harming, just thoughts about harming the baby. And a very small number of moms can move up into a more complex scenario of the psychosis. And in these cases, they can even get into the infanticide, killing the baby. Very rare, but can happen. And it's more kind of related not only with depression, but more complex bipolar disorder and other areas. And there's multiple studies and things going on. So but yes, everything get complicated and complicated if we don't pick up these things early. So early detection, very important for these moms.
For sure. So how, something that I see a lot, especially in breastfeeding medicine, is the way mental health and breastfeeding and bonding are so intertwined. And it's interesting. We always talk about how breastfeeding is preventive against depression, but I think that can be the case when things are going well. But if something's not going the way you had envisioned it, then it actually can lead to these mood and anxiety disorders.
Mm-hmm.
And so it's just, another reason why it's so important to address and to
Mm-hmm.
see that. So people need to see that it can be entering into so many different areas um, of care for both the mother and the baby.
Definitely.
And the bonding, it's interesting. When so I was a psych major in undergrad, and I always remember the study that shows the mom who's just sitting there in
Yeah.
front of her baby with zero expression, and the baby's trying to engage the mom,
Mm-hmm.
and after a while, when she doesn't respond, the baby starts fussing and looking
Yeah.
away and disconnecting because it's so uncomfortable. And, we're all going to have bad days and times when that happens and we're not connecting with our family members. But if that
Mm-hmm.
happens again and again and again,
Every
then it
day.
really does start to affect the mental health of the people around us as well, and our children. Um, and talk about mom guilt. you know, I I
Yeah, it
have
is a
that.
real struggle. It is a real
Yeah.
struggle.
Yeah.
Definitely. I
I
had
have
my two babies during residency. I
Oh
can tell you I
gosh.
had many risk factors and many factors
Wow.
making my life, woo, I survived. I've never had any major problem. But I can tell you how difficult it is not having the depression. Imagine someone really struggling in the
Right.
whole sense of the word.
Right.
So it is something that we need to take seriously and
Yeah.
prepare beforehand.
Right.
Since we know we want to be moms, since we know we are starting to plan how many kids, how I want this to happen, knowing what we want, knowing, having an idea, help us for an easier trajectory when things come surprisingly and we're not really expecting. Things can be harder to really cope with, but again, it's a matter of planning and having an idea of what to expect.
Right.
And I
Right.
think it's an easier way to choose the skills and strategies I'm going to use this time versus next time,
Right.
to move forward.
Right. Right. And I think that's so important. I mean, one of the things that I stress to moms before they have their babies is figure out who your village is going to be.
I
You may
agree.
not need to use everyone, but have an idea of, okay, this is who I think I'm going to want my lactation consultant to be. Here's a couple of therapists that I've heard about in the area in case I need one. Here's a
Mm-hmm.
perinatal psychiatrist. So there are psychiatrists out there who specialize, psychiatrists and therapists who specialize in perinatal mental health.
Yes,
And I
yes,
think,
there's many.
you're not always going to need one of them, but to know that they exist.
Well,
So,
I have referred to them in the past because
yeah,
there's cases and there's cases. And when I encounter a more complex case and this has been in the past, now I work alone. So now I really screen and I make sure I can provide the care that this particular patient needs. But when I had all the assistance and everything, there were cases that I needed to refer, either because of the complexity of their environmental factors that were making this pregnancy more difficult to treat. Now it's in medications. Now it's in a high risk OBGYN treatment plan as well. Now it needs so much comprehensive care
yeah,
that it becomes more difficult for me as general. These perinatal doctors, I mean, who focus in these stages, they have all the resources usually under their own roof. Usually they are more academic in bigger settings, in bigger universities or office near or close to this type of programs.
yeah,
um, and they have more knowledge about everything in detail,
yeah,
and they are important. They are equally important because they really guide us, the ones that try to make their job more easier, so we can actually filter the ones that we can actually take care on, and they can focus on the ones that really need this amount of intensive care.
right,
But
right.
yes, I'm super respectful about this specialty as well.
Yeah, yeah, absolutely. So I'm curious. So you really take a kind of an integrative medicine, holistic approach to your care. And I'm curious how that fits into, what techniques would you use or in terms of dealing with perinatal mental health in particular?
It depends. It really depends on the patient. Every evaluation that I do, I cover every single area of their life. And depending if it's the case that we are going to be doing more intensive therapy, that we have a plan of doing this every week or every 2 weeks, we have actually more detailed planning. And this could be either exercises in session with homework, a lot of self-care strategies and skills to add into their routines or daily schedules,
Okay.
to make sure they have time for themselves and to take a break during the day to say thank you, to be blessed for what they have, to, if they can journal, if they can read, being in sync with their body, because we really need to identify what's going on with us, not
Yeah.
only physical, but emotional and mental, spiritual. All those areas in balance can help us to have a much better trajectory when we are in a depressed state.
Yeah.
We know what we like to do. We know where to go or look for when I have this thought. It's more kind of skills and strategies, and it goes patient by patient. Some people engage a love yoga, so we actually discuss more about what type of things during yoga they can do
Hmm.
while exhaling. Or some people like to do weekly or every certain, acupuncture, or they engage into a healers and sound healers, and it practices that are more into the holistic ways of treating certain diseases, but that there's evidence out there that
Hmm.
with proper procedures, proper guidance, education, and all that, they do help.
Yeah.
And when you really believe on that, what you're doing, it's something that will help you, it will help you. It
Yeah.
doesn't matter in what way. There's many options, holistical options, that we don't have any way to explain them.
Yeah.
It's just that we don't have the explanation, but it has been found to do some sort of response in breathing or relaxation in the muscle, or
Hmm.
some sort of decrease in sympathetic activity. Or so it depends. Breathing techniques, another big one. Breathing techniques is the number one controlling center of our emotions. If we take care of our breathing, immediately after you identify something is wrong, there is a high chance that you're going to be in control the whole
That's cool.
period.
Yeah. Fascinating.
If you don't identify your breathing as going off and then you let your breathing go off, then oxygen start to decrease. I start having my mental fog. I am not thinking clearly. So
Yeah.
it's all together. So any particular activity that can enhance my senses and use my vision, my audition, my tasting, everything in a higher level,
Yeah.
helps you to maintaining balance those aspects in your life:
Yeah.
physical,
Yeah.
emotional, mental, spiritual, all those things.
Yeah.
People who are religious, faith, it's a big thing to stay close to. Um, there's many things to do. Medication, it's another way, not holistic, it's more traditional, it's more evidence-based, scientifically based stuff. The only issue here is that because either we are pregnant or breastfeeding, we cannot study too much moms that
Right.
are pregnant or breastfeeding, because we're not going to subject the babies and the moms into studies unless there's well written consent forms and other factors. But what we have and the evidence that we have is that there is a pretty good safety evidence on certain medications during pregnancy.
Yeah.
So SSRIs and a few of the TCAs are some of the medication well used. In my personal practice, I've never used a TCA. That would be more for a perinatal postpartum doctor specialist to go into a higher level medication. But SSRI, Zoloft, Prozac, very well studied and very well documented their safety.
Yeah.
In terms of breastfeeding, there are, a lot of evidence about the breastfeeding being protective into the postpartum symptoms. So moms that are not yet diagnosed but have symptoms, if they breastfeed, there's a higher chance that their symptoms will improve over time. However, the delay in breastfeeding because of that intentional or initiation aspect of the breastfeeding is affected, that can actually make the symptoms worse. So
Yeah.
not breastfeeding can make symptoms worse. The act of breastfeeding will help them to get better faster or not to develop into the major depressive postpartum depression criteria. But
Right.
it's difficult. It's difficult because of the factors and because of all that. So treatment, it will be geared or focus on each individual underneath. If medication is indicated, we can discuss that. If not, we have to really put that support, education, family dynamics,
Yeah.
family therapy,
Yeah.
individual therapy,
Yeah.
and all those things. And part of the treatment as well, it's the fixing of the factors that are
Right.
contributing to this thing. So
Right.
if I have the postpartum depression and I had the perinatal depression and I had poor care, poor nutrition, I didn't took care of myself, I probably used drugs or medications that affect the all those factors, we need to get a dietitian, make sure she's eating well, make sure that we are taking good care of our body, making sure she's getting her medical treatment, going to her visits, making sure
Right.
the baby's doing well and there's no high blood pressure, preeclampsia. All those things can
Right.
lead to complications.
Right.
So it's
Yeah.
a big field. But
It is.
again, education is a key.
Yeah.
And when we
Yeah.
can help in picking up these patients, we
Yeah.
are making a difference from step one.
Yeah, absolutely. And thankfully, people are so much more aware and there's so much less stigma now so that people feel more comfortable reaching out, which is
Yes,
great that that has changed over the last however many years.
yes.
Well, this has been so, so enlightening. I have really enjoyed hearing all of your insights. And
Thank you.
I'm curious in terms of insights. So, what if you could go back and talk to your 20-year-old self, what do you think you would tell them about either
Whew.
career or even what we're talking about here? I know I found a doozy to throw on you.
You know what? It's a very complicated question to answer like that. It might go into different directions, the answer.
Okay, the
Um,
1-minute answer.
1 minute answer. What would I say to my 20-year-old? I mean, I would tell her, keep doing it again. I would do medicine again. I would again do pursue the career that I have, but I would possibly take a different pathway after I graduated.
Mhm.
I think we are trained in med school that it's difficult to start from zero, and it is. Hello, oh, it's difficult for it to start from zero after school, after residency, after fellowship, and it's difficult to start from zero 10, 15, 20 years after finishing.
Right.
So
Right.
it doesn't matter when you choose to do it. Don't fall in the game of the system telling
Yeah.
you after residency or fellowship you should take hospitalist jobs or this jobs because you have to be in the system to learn that. hey, you're going to learn so much going in through the other way, and you're going to be able to freely practice the way you're trained for, because
Right.
we're trained with this hours and great timing with our patients and awesome, great personal and professional development stuff, but we're not trained for the real world. So we
Right.
can do this. It's just that don't feel there's nothing else than medicine out there.
Right.
There is medicine in other ways that we have never imagined before because we are not told in med school. So I think that that's a
Yeah.
good message for my 20-year-old. Just do it again, but do it better.
Yeah.
You're wiser this time.
Yeah.
And
Yeah.
I think I'm shaping my son in that one. He
Oh,
wants to be a
good.
doctor, and inside me, I'm like, oh my God, really? You want to be a doctor? Like this boy, it's really into the I really want to be an orthopedic surgeon, mom. And
Oh,
I'm like,
wow.
oh my God, he's even know what he wants to do. So I'm like, not discarding him. I'm just
Right.
trying to build up that
Right.
confidence that you can do this. It's
Yep.
hard, it's competitive, but you can make it funner and more, valuable for you when you're really doing it, knowing what weight. So I think me helping him to the shortcuts of things, and will
Yeah.
help him to, and maybe making me feel more stress, less stress that he is going through medicine. I mean, it's just hard.
Yeah.
The
It is
medicine
hard.
world is moving towards a difficult trajectory for all of us, but it's
Right.
on us to train the new generation to be ready and to
Right.
be this massive movement of saying to the system, this is not working, guys.
Right.
You know?
Right. I
So,
think
yep,
that's very smart. Very smart.
yeah.
Well, tell me where our viewers can find you. I will put everything in the notes, but yeah, how if somebody wants to reach out to you as their physician or for
Yeah.
resources or for whatever, how can people find you?
So, thank you, Dr. Rubin. So, I am just a psychiatrist, a child, adolescent, and
Just.
adult psychiatrist in Florida, licensed in Florida. And I do provide services, private services to Palm Beach County residents. So I am located in West Palm Beach. You can find my website, my info, knowing more about me and my practice in www.psychiatryboutique.com. And I have my Facebook and my Instagram page. It's more educational tips, how to do this, how not to do that, different videos here, more educational material, not medical advice or anything like that, just as a way to help spreading the word and mental health matters and keep with the awareness of the stigma. So just helping the movement as a mental health advocate.
Great.
So my IG, Instagram name is Dr. P underscore Psychiatry Boutique. Facebook
Okay.
is psychiatry, no, Dr. P at Psychiatry Boutique. Yeah, Psychiatry Boutique, I will pop up.
Okay.
So that's me. You can follow me
Great.
there.
Great.
And yes, thank you. Thank you for this
Yay.
opportunity, Dr. Rubin.
Well, thank you. I think this has been really helpful. I know I've learned a lot. I'm sure that our viewers have learned a lot. And
Thank
as
you.
predicted, we went over the 30 minutes, but that's because
Ah,
there's so much interesting stuff to
yes,
say. And
yes.
hopefully, this will help people to know what to look for with postpartum depression and to know that it's safe to reach out and important to reach out early and often.
Definitely. Yep.
Yeah.
Even if we
Yeah.
help one at a time, we're making a difference.
Yeah,
So that's my mission.
absolutely. Absolutely. Well, thank you so much for joining me, and we will see you next week on Keeping in Touch.
Thank you.
All
Thank
right.
you. Bye bye. Thank you, Dr.
Bye.
Rubin.
Thank you.
Okay, I don't know what to do